Hi, I hope you're doing amazingly. Hi, welcome to another episode. So this is January 2024 and I thought to myself, what can I start with in this year? And I think as much as I've talked about the signs and symptoms of some of the common presentations in general practice, what I have not talked to you guys about is how to make the most of your appointment with your doctor. So that's what we're going to talk about today. Okay? My name is Joyce. I'm a physician associate here in the UK and I work in general practice. So I'm going to talk to you guys today about how you can make your appointment worthwhile for you and get the most out of that appointment. Okay? Well, I'm going to talk about what you need to do before the appointment. So you've managed to book an appointment. You need to make it clear that what is your main concern? Why are you actually going to see your doctor at that time? Make sure you have notes with regards to your symptoms. Make sure you know you have like a timeline when your symptoms started. You know any other symptoms associated with whatever you've come in with. And also make sure that you know, for example, if you have a headache, is it a continuous headache or is it a headache that's coming and going? Okay, so is it coming and going or is it consistently there? And the other thing is, has there been any change in your symptoms? For example, did your symptoms start off, for example, you started off with a sore throat. Do you now have a cough as well? So how are the symptoms changing? And make sure that you also write down exactly what you have taken. So have you taken any pain medication, for example? And what is that medication you've taken? And has the medication actually helped with your symptoms? So, and what's the severity of your symptom? For example, let's say you've got a headache. Is it like a 10 out of 10 pain? 10 out of 10 is the worst pain. Or is it like a 2 out of 10? You know, like that background pain that is, you know, you're still doing your usual activities, but you know it's there. So make sure you have all that information, because trust me, it will be very helpful for you and very helpful for the clinician. And it will be a much more pleasurable experience for both of you involved. Okay? So, going to the other thing as well to do before your appointment is make sure you know any medications you are currently taking. Make sure you have a list of them. Usually in general practice, your doctor already has the list of medications. But if you've had a new medication started with a specialist that maybe your general practitioner hasn't received a letter for, then make sure you let the doctor know. Or if you are taking any supplements, again, the GP wouldn't know this unless if you tell them. Make sure you let them know. And also make sure you also talk about how do your symptoms or how are your symptoms affecting your daily living. For example, this headache is stopping me from going to work. This headache is stopping me from performing my daily duties at home. Or is the headache just a background pain, but you're still able to do what you normally would? Also, have an idea. You don't have to know specifically, but have an idea of your family history. This is particularly important for like chronic conditions like high blood pressure, or if there is a family history of stroke or heart attack or something like that. Very, very important for your clinician to know that family history, because as much as your GP has information about you, they don't have information about your family, or they might have a little bit from previous interaction with yourself. So you need to volunteer that information to them. Make sure that you prepare questions. So you've gone to your GP with a concern. You possibly have questions for your GP. I know when you go in there, your GP is likely to be the one leading the appointment, in the sense that they'll be the ones asking you most of the questions, but also have some questions for them, assuming that you do have questions. It's almost like going to a job interview, they'll ask you questions, but you ask them some questions as well, assuming that you have any. If you have many symptoms or many concerns, for example, you've got a headache, but you also have, I don't know, you had a fall yesterday and your ankle is hurting. Those are two unrelated things. Make sure you book a double appointment. Let's remember that the clinician has a limited amount of time for each appointment. And here in the UK, the clinician, the GP, can only discuss one concern in one appointment. So if you have other different concerns, try and make sure you book a double appointment. Why am I saying this? Because when you go in there, your GP has enough time to address all those concerns, and you won't come out of there complaining that you haven't, they haven't discussed this or they haven't discussed that. But if they had enough time, they would have done. So try and make sure you book a double appointment if you know you have several things that you want to talk about. And that again will make sure that both of you have a much more pleasurable and much more fruitful appointment. Right. Another key thing, arrive for your appointment early. Why is this key? Very, very important. Go there early. Make sure you've booked yourself in and checked wherever you need to check that you are there on time, so that you're not rushing in, so that you have your full appointment. Because if you're rushing in there late, your GP, like I said, has a very limited amount of time. They've got set patients one after another, back to back. So if you're late, imagine how that impacts the rest of the patients. That's when your GP might then say, okay, we need to book another appointment because I can't see you. Because they want to do justice to you and make sure that they explore all your concerns. And if they have literally 5 minutes left, they can't do that. So make sure you arrive early. The other thing is, the next part is what to do during the appointment. So you are in there and you're facing the doctor. Make sure you discuss your main concern. Right. If your main concern is a headache and you happen to have a rash, do not start talking about the rash before the headache. Why am I saying that? It comes back to the other point that I said earlier, because they have limited amount of time and you want to get the most out of the appointment. So if you talk about the rash, that is the list of your concerns, when you should be talking about headache, because headache could actually mean something more serious. So make sure you talk about your main concern first. Then if there is time, then they can talk about the second thing. But if you don't have a double appointment, they might not be able to discuss that with you as well. If you're someone maybe who has maybe a learning disability, but not only that, if you're someone who maybe is forgetful or you feel you just need support. For example, with regards to most mental health patients, you might find that maybe you just need that extra support. So bring in a friend or family or whoever you want to bring in just to support you in that appointment. And that person can actually give us what we call a collaboratory history, so they can also tell us some of the things. For example, if someone has a mental health problem, it could be that they are then going to be tearful and quite upset, and having that second person there will mean that that person can help to fill in the blanks for the clinician, so that ultimately the patient gets the most from the appointment. Another thing, be honest and be clear. So be honest with your clinician. So if they ask you, do you take recreational drugs? If you take them, tell them, why am I saying this? Because depending on why you've come in, maybe that recreational drug is linked to the symptoms that you're having. And if you don't tell your clinician, they are not going to know. There's a saying that says, never lie to your doctor or your lawyer. There's a reason for that. So please be honest and be very clear. I've had patients where I'll ask, maybe they've come in with a cough, and I ask, do you have shortness of breath? And they'll be like, I'm not. So be clear. With shortness of breath, you know you're having it or you're not, for the most part. So be very clear, because again, it helps me help you. And if you are going to have an intimate examination, so an intimate examination most likely might be to do with, maybe I need to examine you down below, whether male or female. So you can ask for a chaperone. Usually the clinician will offer one anyway, or they will insist on one anyway. But if they don't and you feel you need a chaperone, please ask for one. Going back to the point that I said here, make sure you then ask your questions, assuming that you've prepared your questions beforehand. Ask the questions. Or if questions come up as you're having your conversation with your GP, ask those questions. They're here to help you and to get the best for you in terms of your health. So ask them questions and they will answer those questions. If you want to, depending on how complicated your symptoms are, or how complicated maybe your past medical history is, you might find it helpful to take some notes as well. So take some notes so that when you go back home, because they've given you all this information and they've said so many things, and if you're unwell, sometimes you're so overwhelmed, you don't really process everything at that same time. So if you take notes, that will help you to go back and then just recap on them and see what you discussed and what you need. What questions might you ask your clinician before you leave? So before you head out of the door, you might want to ask about treatment. You've come in, you've spoken about your symptoms, so you can ask them about the treatment if they haven't already volunteered that information to you. So they might say, oh, you need antibiotics and whatever. Then you can ask about, okay, how long are you taking the medication for example. And you can also ask about any further testing. So for example, you've come in with a cough and it's been going on for 2 months. Maybe you can ask about, okay, what further testing is going to go on. They might decide they want to do a chest x-ray, for example. Then you can ask about, okay, if I'm going to do a chest x-ray, where am I going for the chest x-ray, and how long is it going to take for me to get the results, or how am I going to get the results? So usually they might say, okay, we'll call you back in, or we'll call you and tell you the results over the phone. So just to make sure that there is some kind of continuation from your appointment, it's very helpful for you to know that information. So again, you can ask questions about your symptoms. So how long are my symptoms going to last for? For example, if you've come in and your doctor says you have shingles, you can ask, okay, they will treat you with the antivirals, but you can ask, how long am I expecting the rash or the lesions on the body to actually clear? It could be that it will take about maybe 2 weeks to 3 weeks. So just some kind of timeline as to how long are your symptoms likely to go after you started the treatment. Or if the decision was not to give you any treatment because the symptoms will resolve by themselves, then you can ask about, okay, so how long should I expect before the symptoms clear? So you can ask those questions and your clinician can answer those questions for you. And also the other thing is, I personally like sending my patients an NHS link to whatever their condition is or whatever the diagnosis is. So for example, there's a link for NHS with regards to a cough, how long it takes, what you can do, what are the symptoms and all of that. So I could send you that link if you were my patient, and then you can have a look and see. and it's just on your text and on your phone, so it's easy for you to then go through that at your own time. The other thing is you can ask about general support questions, so just ask about more information. For example, if you have had a new diagnosis of diabetes, for example, you can ask about what other help is available for you. Are there any support groups out there? And your clinician can be able to tell you that, or they might give you a leaflet with regards to that. So those are some of the questions you can ask your clinician, and they are likely to give you an answer too. So, okay, so you've had your appointment. So what happens after the visit? So make sure you continue recording your symptoms. Sometimes, for example, if someone has come in with a headache, I could ask you to go and do a headache diary. If you've come in with the tummy pain, I can ask you to continue doing like a diary with regards to your symptoms. For example, what you've eaten, what you've eaten, so that we can just assess, does whatever you're eating have anything to do with the tummy pain that you're having? So your intake could be something that you can write down as well, depending on what your symptoms are. So make sure when you've gone and you've written your symptoms, and if the symptoms don't resolve in the time that your clinician has told you, please feedback to your clinician. Remember, your clinician is seeing X number of patients, and they might have booked you a follow-up, but they might not have booked you a follow-up. So please make sure you return if your symptoms have not resolved, or if your symptoms are actually getting worse, or they are concerning to you. Obviously, if this happens over the weekends where general practice, we don't open the surgery, then please go to the accidents and emergency and make sure that you're seen. So one thing we don't want you to do is to continue having the symptoms and none of us know, and you're suffering with these symptoms and we don't have a clue. So make sure that you come back to the clinician, or come back and book an appointment, so that we can review you if your symptoms are still persisting. Let the clinician know. Also, with regards to medication, if you have been given medication and it hasn't worked, or you feel your symptoms are still persisting or even worsening, make sure you feedback that information to the clinician, so that maybe they can give you an alternative. Another thing, if you experience side effects, make sure you feedback to your clinician, because they are not going to know that information until you give that to them. Top tips in terms of in the UK. So I'm just going to talk about, in the UK, we have, most practices have an e-consult option. So you go on your practice website and you can go through what they call the e-consult. So you fill in a form with regards to your symptoms, and then usually most practices will say they'll get back to you within 24 to 48 hours. So for us, where I work at the moment, most people are being seen or being contacted within hours of filling in an e-consult. So please explore that option in trying to get appointments, because you might be seen sooner using that route. I'm not guaranteeing that, but that's an alternative to you being seen. I have used that e-consult myself with my practice and my doctors, and I have had a response within 24 hours, and I had a call back and then antibiotics sent to my pharmacy using that system. So I know it works for most practices. Okay, so try and explore that option as well. Prior to an appointment, if you have a preferred clinician, depending on what the setting is for the practice where you are registered at, you might find you have specific clinicians which are there permanently. So for example, I work in my practice 4 days a week. So some patients will ask, okay, I want to see you next time, or I want us to review this next time. They'll ask for my name, which I'll give that to them, and then they can book in with me. So some people have a specific preference for a specific clinician. So it helps you and it helps your clinician if there is that consistency, because they know by the time I see you the second and the third time, I know your history more or less. And I guess at that point, I'm comfortable with you and you're comfortable with me. So we can get the most out of the appointment. So consider saying your preferred clinician if you have one. And like I said earlier, make sure you know the treatment plan when you leave your doctors. Don't call later on and be asking for the treatment plan or asking them to call you back. Make sure you're clear on that before you leave. In general, NHS waiting times with regards to referrals are longer now, unfortunately. So please be patient. Please be patient. And where you have had contact from the hospital where you've been referred to, it might be worth contacting them to find out when they will see you. Okay, I hope this has been helpful, and I do hope ultimately that it will help you to make the most out of your appointment with your doctor. Okay, I hope that it will help you and the clinician who sees you by trying to just do the things that I talked about in this video. If this has been helpful, please hit the subscribe button and make sure you share and you like this video so others can also get this same help that you've had. Take care, and I'll catch you on another one. Have a lovely week. I'll catch you later. Bye.